Today I'm going to show you how to do low dye strapping, which we often use as part of our treatment regime for heel pain. So you want the patient's foot and leg to be at 90 degrees when you're applying the strapping tape, and I always cut the tape first. So we have 2 long pieces of tape, and depending on the length of their foot, 4 to 6 pieces of shorter tape. Obviously you need to check that your patient doesn't have an allergy to zinc oxide, which is the sticky stuff in the tape. So the first piece starts just below the little toe, and it comes down the outside of the foot, and with a fair amount of force you're bringing it up to the inside of the foot here, and you want to adhere it just below the big toe, but before you stick it down you must bend the big toe joint up towards the patient, and that shortens the distance of the soft tissue underneath which is damaged. And then rub it in to contact the skin, and then with the shorter pieces we start on the outside of the heel and line it up with this outside piece of tape. And these need to be quite firm, but not so firm that you get creases in the skin. So you just need to be mindful of little creases and make sure the tape is adhered onto all the bits of skin. As we come further up the foot, the skin's looser, so we're more likely to get a crease, so we'll have to decrease the tightness. The second piece overlaps the first piece by about 1/3, with a little bit of force, but being mindful of creases. And then the third piece overlapping again, and as you go across the foot, pushing it into the skin so we don't get any creases. And then we move on to our second long piece, which goes directly over the top of the first piece, starting on the outside of the foot, coming around, and before we adhere, just pulling the toe back towards the patient again. And as I said, that will just decrease the damage to the soft tissue because it shortens the length between here and here. And then we use our remaining pieces to come from the outside to the inside, and across here they're quite loose because the skin's a fair bit looser here. And making sure it's all well adhered.